Everybody, John Swift here with a kind of an informational video for you guys. So one of the first things I want to tell you to preface this video is I have somewhat of a experience with infectious diseases and keeping safe, and from the flus, colds, TB, all these different transmitted things. First of all, what I'm wearing right now is called a surgical mask, okay? It's got the ear things right here, goes over your ears. This is not gonna prevent you from breathing in a virus, okay? Because according to my, I'll get to why I'm wearing it in a minute. According to my background at the hospital, where I used to deal with patients and I had to deal with patients with infectious diseases and things like that, we did not wear these masks. So even though it looks like it's kind of sealed, this is not the mask that you should wear. If it makes you feel better, fine, wear it. I'm just making an example. I'm not wearing this mask, but it's this style, okay? This is what you call the N95. It says right here. It's got a bunch of numbers on it, but right here in small letters it says N95. Can you see that? I use this one in my shop. It's kind of dirty. This is what you use when you're around infectious disease because it seals more around your face. Let me just put the phone down just for a sec. I'll put this on real quick. Okay, so can you see the difference between this one? It seals around your chin. This is what you wear when you're around infectious patients. This one's actually supposed to be up here. When you go into an infected area, this is what you wear. If you don't have access to this and you have access to this, that's fine, okay? This is what you'd wear at the hospital. This is a hospital issued mask where I used to work at a hospital. Just for starters, like I said, if it gives you comfort to wear the surgical masks, these are cheap, fine, do that. But don't just think that that's the answer. These are designed for surgeons so they don't cough into your wounds when they're operating on you. That's why they wear these masks. It's more of a, what would you call, bodily solutions, stuff that comes in and out of your mouth. My hair, look at my hair, wow. It's like some static electricity. That's what you wear, is these ones with the earplugs. That's what surgeons wear. Well, why wouldn't surgeons wear ones that have infectious, if they're operating on somebody with infectious diseases, yeah, they'll wear this N95 deal. But we got some other things to get through, so if you have any questions about that, just leave me a question and I'll try to answer it. So what I used to do is, I used to work in dietary. I had to go talk to patients in their rooms, and sometimes when they had infections. So they had these on the doors, and you would put these on. I hope you can see the difference. How it's like a cup. These are probably sold out. I don't know if you can still get these, but if you want the best protection, like I said, these N95s, I'll give you a good look at that, how that looks. It's got two straps on the sides, so it's pulling a seal around your face. Anyway, yeah, I used to deal with, have to go to patients' rooms where they were infectious diseases, and I would, for the ones, they had different levels. For the ones that were not super infectious, like with TB or some kind of, bad disease, I can't think of, whatever kind of diseases, the nurses would have to deal with them exclusively. The nurses have to put the gowns on, and like a mask, and I think sometimes eye protection too, just in case. But like I said, just so you have that. And so the other thing I learned recently, and I'm gonna put a link in my Facebook page, Mr. John Swift Facebook, to an interview that Joe Rogan did with a guy who's an infectious disease detective. He's head of like the Centers for Infectious Disease, I can't remember the exact name, but on that video he explains how this is an airborne disease. Now, I think the idea of why Trump is going on TV and saying Wash your hands, don't shake hands, bump hands. This is what I think the reasoning for that is. Look at this green wall over here. That's a little bit more exciting, a little bit more colorful over there than this wall for some reason. I'm at a restaurant, by the way. There's actually people here, but they are taking precautions here to make sure people aren't sitting at the bar. Can you see that? People aren't sitting at the bar. They're sitting further apart. For some reason, they have a rule of 2 people per table. And this is an outdoor type of thing. This is where they were shooting the commercial at. See, it's an outdoor. I think this is better because the germs aren't contained in an area. This is a really open air area. And I was talking to the guy who was out here cleaning. They say that they're enforcing like the 2-person to a table rule. They're disinfecting the tables. It's all good. Okay, so let me get to the part about hand washing. So what I think they're thinking as far on a national level is telling people to wash their hands, maybe wear gloves, and don't touch your eyes because we don't need people getting the cold, other minor things that you can get from, like bacteria that you can get from touching dirty door handles and things. They don't want people at the hospital for that. They want to reserve most of the areas for serious virus as much as they can because they know they're going to be overwhelmed. They're even short on supplies at this point too. Which that interview with Joe Rogan with that guy, the infectious disease specialist, is talking about the supply chain and how they're already short on supplies because of international issues with China and how we've outsourced a lot of our medical drugs and things like that. That's all covered in that video. I'll try to get that up today so you can listen to it because it's got really good facts on this. This guy did this 2 weeks ago, and he's been researching this virus since it started about how it's transmitted, how it's spread, some of the facts about how long we expect to be dealing with this exposure. So why am I outside? Well, you can see I'm sitting by a table by myself, and I'm sitting far away from people. I work, the other issue is I work at a public store where people buy food and supplies, okay? Every day I go in, everybody's panic buying toilet paper, sanitary wipes, antibacterial wipes, antibacterial sprays. Like I said, that is sort of feeding on the fact that you're going to touch something that somebody else touched and you're going to be transmitted disease. And what I think, from my personal experience of working at a hospital for 10 years, is that we don't need those people getting sick with the cold, other bacterial infections at the hospital at this time. So the less people they have in the hospitals with lesser bacterial infections, the more space they're going to have for the overflow of patients that they expect to have from the coronavirus. So that's the reason I think they're telling you to wash your hands, maybe wear gloves, don't touch public stuff, stay inside, stay away from any bacteria you can. Once again, I'm repeating, it's an airborne virus. Now, I'm not saying, let me clarify when I say airborne virus. It's not floating around in this public space. How do I know this? Because I've done some research. I've done the research. And I've listened to, hey, Trump's on TV right now. It says, breaking news, Trump is not currently considering a nationwide lockdown. I don't know if that's live. Let me see what that is. That's live on CNN. And I watched the brief yesterday. We'll just put him in the background. There he is right there. This place isn't open because it's too small and they think that there's too high a possibility of germs being contained in there. So he's doing a question and answer, it looks like, on the television about this. Okay, so anyway, the reason I'm out here is because I need to use the Wi-Fi. But like I said, I'm not sitting by other people. And I'm also not worried about it because I think in an open area, if somebody had the coronavirus in this area, they're farther enough away, they're not coughing on me, they're not breathing on me. That's what my main concern is. And also, I'm not worried about getting it as much as I am running out of money and not having food and things like that. That's my main concern right now, because I'm low on cash already. I'm trying to catch up on paying bills. I'm not worried about catching it and dying. I'm worried about, I don't want to catch the virus, and I don't want to be sick. And so I'm taking my own precautions. I'm staying home a lot. I'm not out in the public except for today. Like I said, I need to use the Wi-Fi because I don't have the Wi-Fi at home. So this is my best advice for you guys, based on being exposed to medical procedures for 10 years. We always had to. We were always giving updates on, like when you have SARS and stuff like that, they would update us on what procedures we're supposed to be doing and things like that. So every year we were notified about that. Like I said, it became part of my daily thing, is where I'd wear gloves most of the day, and then I would wear these masks too, and I followed procedure, and so did everybody else. It was just a daily thing that you got used to. Just be aware that you're around sick people, and try not to overexpose yourself to that thing. Like I said, I'm going to go back to the hand washing. It's a good idea to wash your hands and be sterile. But we're not talking about a cold here, where somebody coughs on you and you get it. Airborne would be somebody breathing on you. You being in an elevator with somebody who has it. I guess the transmission of it seems to be, it's very easily transmitted, more so than I would say a common flu, and it seems to be quick. So the idea, what I think we're doing is we're shutting down restaurants, we're shutting down schools, we're shutting down the Burger King you can't eat in, Taco Bell here you can't eat in, and I'm figuring that they're following suit, because the Florida governor has set guidelines to which restaurants, how you can stay open, if you have an overcapacity, what you should do. As far as this restaurant, the guy told me that they're trying to minimize the amount of people here. He's an outdoor, part of it's outdoor, so they're trying to get everybody to eat outdoors on these tables. Because you think about it like smoke, how smoke, if somebody's smoking, the cigarette smoke dissipates and it sort of goes off into the atmosphere. And you could catch a disease that way, yes. But if you're sitting right next to me and you're talking to me and there's virus, you're breathing out your virus bacteria, that would be something that would be more dangerous. All right, so let's get over past the whole contagion thing. Like I said, washing your hands is a good idea, and just being aware of what the newest updated information is as far as what they're telling you. It's a good idea. Wash your hands, sanitize stuff. Don't get a cold now. Don't get don't get pink eye. Don't get an ear infection from somebody else. We need to keep the hospitals free of those lesser bacteria, so we have the capacity for the major virus outbreak, which they say it's going to be going on. Okay, part two. We'll just cut to part two. I think I've actually over-talked about that issue. We all need food, and we all need toilet paper, and we need sanitary supplies. The toilet paper is not running out, folks. I work at a store where you sell toilet paper part-time. I don't sell toilet paper part-time, but I work at a store part-time where they sell toilet paper. They are not running out of toilet paper. Let me repeat that. Look into my eyes and hear what I'm saying. Listen to what I'm saying, but look in my eyes to what I'm saying. We are not having a national paper shortage. The reason we don't have available paper is because assholes bought 6 months supply of toilet paper, and we don't have any because of these preppers or I made up porters, people who are hoarding, paper hoarders, these porters somehow think that if we have a virus, we're not going to have enough paper. I don't really understand what that is. Okay, so let's break that. Let's just unpack that for just a second, the whole paper issue. And that goes for toilet paper, paper towels, Kleenex, sanitary wipes. Everything is getting wiped out as soon as it gets into the store. Worst comes to worst, folks. We can go in your tub or your shower and you can wet a towel down and you can clean yourself. Okay, it's not going to be the end of the world if you don't have toilet paper. I would recommend that the thing that I see on the shelves the most at the dollar stores is facial tissue, Kleenex. That works just as good to wipe things. I would prefer the myself, like the baby wipes. They're all bought up too. People, we cannot get nuts. So let's get to the meat of unpacking this paper issue. There are elderly people who are not able to get into the tub and wash themselves, okay? My ex-girlfriend is a caregiver for people who cannot shower by themselves. Those people need the toilet paper because they cannot get into a tub and clean themselves. And or stand in a tub, rinsing, whatever you gotta do. You know what, does anybody know what a bidet is? That's a little spigot or a spray that sprays off your behind when you're done doing your deals. That's what I would recommend people think about doing if they run out or they wanna. So this is what I'm saying. If you're an able-bodied person and you don't desperately need toilet paper, despite the fact you think you need toilet paper, or I'm gonna die if I don't have toilet paper. To get through this, we need to work together as a community. Think about the elderly, disabled people who don't have the mobility to get up, people in wheelchairs, people that they need toilet paper or moist wipes, whatever they call it, cleansing wipes. I don't need it, okay? I can go out with a hose. I've survived in places like Nicaragua and different parts of the country, out of the country, third world countries, without toilet paper, camping. We can do it. We can do it for the sake of our neighbors. Our neighbors, our loved ones, our elderly loved ones, our grandparents. Think about those people first. And if you're able-bodied, not bottled, think about that for a second. If you were a 90-year-old person that was possibly disabled, and maybe you lived by yourself and you don't have a nurse, that could be crushing and debilitating for that person. So let's try to be, I want to end this by saying, let's try to be more generous and more thoughtful at this time that we're all facing these issues of critical supplies and health issues and things that we're letting fear take over, like that we're going to run out of toilet paper. I can almost 100% guarantee you that we're not running out of toilet paper, and it's not going to be a prepper thing where you have to have 600, a month's worth of what am I trying to say? Canned goods and stuff that you don't have to cook and or whatever. We're not going to lose electricity. We're not going to lose water. We all just need to take a breath and understand that we'll get through this. It's just going to take some time. Like I said, my biggest worry is not having money for paying bills, paying my mortgage, things like this. That's what my concern is, that I won't have money for food or something, and that I'll have to borrow from people or whatever like that. This is really the least of my concern is masks and paper and gloves and things like that. So I just want you to open your mind to what I'm saying and think about that. We're not going to get through this if people are just hoarding everything, because then the people who really need it, who can't get in at 6 o'clock in the morning and run to the shelves and get toilet paper. So just a little reminder from me to you, like I said, take in consideration that I have had a lot of experience with infectious diseases and being around that I have experience with that. So let's just not go crazy. Let's try to take a breath and be generous and maybe help our neighbors out, you know. Look out for your neighbors. If you have an elderly neighbor, maybe check on them to see if they're okay. It's not a hurricane, it's not a tornado, it's not a typhoon. It's an unseen virus, and we just have to deal with it. And we all need to do the best we can and be thoughtful of others also. All right, so anyway, go to my Facebook page. I'll be posting that video with the disease expert. Trump's still on TV over there. It says that this is live, this is not currently considering a nationwide lockdown. I don't know how they would lock down like stores and things like that, because there's people that need, you know, they have kids and they have food and they need diapers and they need stuff and they need, you know, kids stuff. Let's just be considerate, kind, and generous, and not greedy and hoardy, and do that. All right, so that's it. That's 21 minutes of my best guess of what's happening. So maybe I'll update this next week and just let you know what's going on. Anyway, I'm hoping for the best. I'm trying to be optimistic in my brain. Like I said, you know, I'm dealing with financial problems, and I also have a neck injury that I'm dealing with. So it almost takes my head out of worrying about getting sick, because I'm having pain in my neck. Anyway, so we'll see you in the next video, guys. Take care, and really just be considerate of each other and be kind to your neighbors, because we're all in this together. We'll see you next time.